Hello, everyone. Welcome to our Softfield Academy webinar, and a warm welcome to our KOL, Dr. Riekie Smit.
Thank you very much.
You're welcome. So we will begin slowly. Meanwhile, we are waiting for everyone to be connected. So I will explain very quick how this webinar will be held. So it will be in two parts. The first part will be the presentation of Dr. Riekie Smit. And then after we will answer to all your questions and answers. So don't hesitate to go to the Q&A box and let your question there. Dr. Riekie Smit will be pleased to answer them. Also, don't forget that this webinar is being recorded. So tomorrow you will receive a newsletter in which you will have a replay that will be subtitles in French, English, and Spanish. And yeah, I think we can begin. So I can begin with presenting Dr. Riekie Smit. Can go to the other slide. So, Dr. Riekie Smit is an aesthetical medical doctor from South Africa. She's also our KOL of the Softfield Academy. And so she has her private practice in Pretoria in South Africa, and she's focused in aesthetic and skin treatments. And beside her practice, she has a lot of other activities. So she's a senior faculty member of the American Academy of Aesthetic Medicine training doctors all over the world. And she's also founder of the Aesthetic and Anti-Aging Medicine Society of South Africa. And she's also scientific chairperson of the Aesthetic Medicine Congress of South Africa. She also developed courses for the officially recognized advanced diploma in aesthetic medicine. And she's also a global KOL for various aesthetic medical companies and in the industry, including Softfield. And of course, we are very, very pleased and we are very happy to learn new things from you, Dr. Riekie Smit, and new method injection. So and so today we will present our team as precise filler placement for tricky areas. And I will let Dr. Riekie Smit to present her presentation. Thank you.
Thank you very much for the introduction and welcome to everyone. So I'm very happy to share some tips and tricks on how to choose the right type of cannulas to treat those tricky areas, those risky areas, and maybe difficult to reach areas. So I will start with just a brief introduction on the Softfield, just so that you also understand the videos that I will be showing you, because I think it's important first to understand which type of cannulas they do, to understand which type of cannulas I will be using in the practical videos, because I've prepared some really wonderful videos to show you all of these tricky and difficult and risky areas to treat with cannulas. So as some of you may know already, the Softfield range contains two different types of cannula, called the Precision and then the Easy Guide range of cannulas. The Precision is your typical cannula that comes with a needle packaged inside of the sterile pack, that you make an entry point with a needle, and then you have different types of ones. And the needle is also adapted, so they have the very large gauge or small gauge but large cannulas for the body treatments. That's quite nicely new launched, that you can use for many type of body treatments. And then the face range, ranging from the 22 gauge up until the 30 gauge. So what is very unique on the Softfield Precision range of cannulas is the fact that they have got very different lengths that really can be adapted for all of what I'm going to discuss, specifically those tricky and the risky areas. And that really makes it very versatile. So each cannula obviously is fitted for specific zones and very precise product placement, and sold in a box of 20 according to the country. So what is different from a Softfield cannula? And I have to tell you, when I started using cannulas, I really had this idea that cannulas are cannulas and they're all the same. And then I heard a lot of people talking about Softfield, and they want to use Softfield, and the experts at the International Congress are saying, I only want to use a Softfield cannula. I thought, what can be so different? And then until I started using Softfield cannula, that I realized there's really something different. It's like really, I think the difference between riding an ordinary car and a Ferrari, there is a difference. So that is something that is very unique to the Softful, is this the way that it has been made. And what we can see from this compared to competitors is it's got this optimal round surface. So it really is different when you go through tissue. It's different when you reach those difficult areas. So the gliding of it is really different. It's got enhanced gliding, more safety, especially with its round tip, because some of the cannulas have got not such a round tip and it can actually break vessels. And we see that sometimes with cheaper cannulas that you get a lot of bruising, especially like when we treat superficial temple areas or the forehead areas in older patients, and there's a lot of bruising. So with this optimally round cannula point of Softful, I've really seen so much more safety in my patients that I'm treating. Then the other factors that make it very unique is this graduated design to really make it precise for you to know how deep you are. And then a very perfect combination of rigidity and flexibility. And this really makes a very big difference as to how easy it is. So there are cannulas that are more difficult to use. And then there's Softful that makes it just so much easier. The other reason why it's so much easier to glide is the silicone coating over it. And then it's got a very unique lure lock system. It doesn't really pop off. So you need to obviously secure it in, but it's got a very unique system that you've got a lower risk of popping off and then your filler that you lose. And then what is also very nice is this little red dot that shows you where is the orifice. So it shows you where your filler needs to come out. And I think that's very important because sometimes, like for instance, with nose fillers, we want to insert the cannula and make sure the product is going more to the surface. So then you want to make sure the red dot is at the top. And for instance, for the forehead, when we go into the forehead, we want it to be on the bone. So then we want the red dot to be at the bottom. So it can really then go deeper. So that is very important for precision. So then the other types of cannulas that they make, or not other cannulas, but the other type of the two ranges is the Precision and the Easy Guide. The Easy Guide has won many awards because it's this very unique system that makes it easier for us to actually put the cannula into the skin. It's a pre-hole needle. It looks like a little butterfly or this little triangular thing, and it's a guide to insert the cannula. So why do we need this Easy Guide? So it just makes it easier to put the cannula in. It guides the cannula and it helps the doctor, especially if your eyes are not so good anymore and you can't find the hole. It just makes it so much easier. So it's almost like a hollow needle that you can see on this video, and then the cannula then glides through. And it really is reduced pain for the patient, but a lot of precision. And it, as soon as you start working with it, it just becomes so much easier. So you can see on the video, you put the Easy Guide in, and then you slide the cannula in. And as soon as the cannula is inside, within half or 1 centimeter, then you remove the Easy Guide and you just put it on the table. And it's also very uniquely designed. If you put it on your table, the needle points to the top, so it remains sterile so that you can still use it on the other side. And I think that's a very clever part of the design of the cannula. So this is just quickly showing the two videos. When we use either just a needle or the Easy Guide, it just makes it so much easier to place it. And you can see you remove it as soon as you've put in your cannula, then you remove it. And it really, it spoils you. As soon as you start working with it, you don't even want to go for the normal needle anymore. You become so used to it, and it just makes your life so much easier that you don't want to go back to using a needle. So I initially thought, well, my eyes are still very good. I'm very fortunate, and I don't need the Easy Guide. But it's when I started working with it, now I only want to use Easy Guide. So something that I really would suggest that you try working with the Easy Guide. It's like just spoiling you, saving a lot of time. And especially when you're doing a demonstration, it saves you the embarrassment of not finding the hole. So it really makes quite a difference there. So here we can just see it. I'm not going to go into more detail. You'll find a lot obviously on their website and on the academy. It's a very simple step, and you'll also see it in the videos. I'm using a lot of the Easy Guide. So here you can just see the design of it, very ergonomic. And then obviously the Easy Guide also has got a range of cannulas, the 22 gauge, the 23 and the 50 or 70, the 25 and the 27 gauge. So quite a big range. So this is just a video showing how to actually just put it in, slide it in through, really not very difficult. So you just need to make sure that you've got the hollow needle at the top of the easy guide, then you slide it right in and then go through. So you'll see with all of these videos, it's very easy to use and very nice for the chin area also. Okay, so very precise and very nice to use all of these ranges. So what I'm going to show you is how to choose the right cannula to make sure that you have a comfortable injection and technique. And what I mean with that is that you as the injector has to be comfortable. Sometimes your cannula is too long and you find that it's not going where you want it to go. If it's too short, then it doesn't reach where you want to be. So you need to choose the right cannulas so that you are comfortable while you are doing it, so that you can focus on